Welcome everyone to this second session on the value of TYA, a presentation of the research and findings of a 3-year project. TYA means Theatre for Young Audiences. We also include all performance in that, as it says in the Constitution. So the value of theatre for young audiences. Before I begin, I acknowledge that I live, work and make art on the lands of the First Nations peoples of Australia. I pay my respects to elders past and present who offer legacy, pathways and experience to us all through their unbroken connection to lands, waters and communities. I acknowledge First Nations children and young people as voices of the present and as the energy of the future, and all First peoples everywhere holding culture and country with such care. I am speaking to you all from the lands of the Wurundjeri people of the Kulin Nation in Naarm, now Melbourne. This land was never ceded. This today is a co-presentation of the research of value of TYA by the Create Centre in Sydney and ASSITEJ International. Michael Anderson will talk briefly about this and of the Create Centre a little later. But first, some background. Children and young people have important human rights to play, to freely access culture, to engage in self-expression, and to experience challenging, complex artworks and new ideas. This means that the art that children and young people create and experience is important in its own right. But it also has real and significant positive outcomes for the participants themselves, for their physical, emotional, intellectual, and social well-being. And it's important for our understanding of culture, our communities, our economies, and our societies. As part of the Building Collective Resilience project, which is co-funded by the European Union, ASSITEJ International appointed lead researchers to help collect and disseminate data, information, practices, ideas, and solutions around several areas of our work. How children and young people have access to theatre and performance, how and where they experience TYA, where is the diversity within TYA as a sector, what is the perception of early years within TYA, and the overarching study we're hearing from today, the value of TYA. We're delighted to announce also that the association has been successful in another 4 years of funding from the European Union. And with the learning from all these vital research projects, we'll be able to continue with even more focus into the next steps. During December, members will hear from all the current research projects, so keep an eye out for dates and times. And today we're going to hear from the Value of TYA team, Kelly Freebody, please wave, Michael Anderson, and Eliza Oliver. Dr. Kelly Freebody is a professor in the Faculty of Arts and Social Sciences at the University of Sydney. Her research focuses on drama, young people, education, and social justice. Kelly has been an investigator on several research projects exploring drama and theatre with young people and published extensively in the area. Dr. Michael Anderson is a professor of creativity and arts education at the Sydney School of Education and Social Work at the University of Sydney and is also co-director of the Create Centre. He is an internationally recognised educational leader in how young people engage with arts and creativity. Eliza Oliver is a research manager with the Create Centre in the University of Sydney. Her background is in theatre and clinical psychology, and her research interests are in the intersection between applied arts and mental health. About Create. I'd like to hand over to Michael now, just to talk briefly about the Create Centre, which is co-hosting today's session. Over to you, Michael.
Thanks, Sue, and thanks very much for ASSITEJ for hosting us this evening and giving us this opportunity to explain this research and take your questions. So the CREATE Centre is a centre of the University of Sydney, and CREATE is an acronym that stands for Creativity in Research, Engaging the Arts and Transforming Education, Health and Wellbeing. And in a sense, that's exactly what we do. We are a centre that researches, advocates, and teaches around the application of the arts in education, health, wellbeing, and other settings. And in fact, it's free to join CREATE if you're interested in the kind of work we do. I'm going to drop in the chat a link where you can join CREATE. You can see our research and you can get involved in our webinars similar to this one on the way that we apply arts in the world. And we'd really love to see you on a future webinar or to hear from you at any time. We're an international centre, so really look forward to your participation. Thanks, Sue.
A pleasure. Thank you very much. So now we'll get into the body of the presentation, and I'm going to hand over to Kelly Freebody.
Thank you, Sue. Good evening / morning, everybody, wherever you are. Thank you very much, Eliza. So today, as Sue introduced, we're going to be talking about the stream of the ASSITEJ research projects, the European Union-funded research projects that we worked on, which is an exploration of the value of theatre for young people. More explicitly, the research was about collating and mapping what we know about the impact of theatre for young audiences or theatre for young people, which was stream 5 of the Building Collective Resilience project. Before we begin, as others have, I want to acknowledge that I'm joining today from Gadigal land. This work was done in Gadigal land, but it's the land where the University of Sydney stands. It's also the land where I live and I raise my children, and I do so with deep respect for the elders of the Eora Nation. Can we go to the next slide, Eliza? Yeah, we probably don't need to do that. Let's move here. Okay, great. So just to give a sort of a background and an introduction to what we were trying to attempt with the way we designed this study. The conversations that we had originally with ASSITEJ were about how this study fits into the broader Building Collective Resilience study, which at the core of it was trying to do a deep dive understanding of our field and understanding what is needed in our field to ensure the resilience of our field, where some of the challenges were, where the opportunities were, where our strengths were. And so, as Sue said, the explorations range from looking at one of the streams, looking at all of the quantitative data that we have about young people and as audience members, through to looking at deep dive case studies in stream 2, and then other streams looking at diversity and looking at theatre for very young children. The conversations that we were having were about how is it that we know how and what to advocate for our work? More kind of broadly, how as a sector do we understand the value of our work around the world? One of the really interesting about the work that we do, I think somebody is unmuted. If I could ask you to mute, that would be awesome. One of the really kind of fascinating things to think about our field as a researcher is that a lot of the work that we do, while it's extremely participatory and in some ways is extremely public, it's also from a research perspective quite private, in that there is literally hundreds of thousands of theatre for young people projects happening right now all around the world, if not more. And yet there's no kind of consistent way of organizing or understanding or even publicizing the outcome of those grants beyond the individual programs often doing it, or researchers coming and trying to kind of do specific research projects in specific areas on specific topics that they can get funding to do. So one of the things we asked the question of, what would it look like to try and map what we do globally and how we understand the impact of our work globally. And why would we do that? Well, there's a few reasons. One, just for the sheer understanding of what it is we do that's shared, how it is that we overcome specific challenges in different kinds of contexts. Secondly, for us as a field to know how work is different in different contexts and for what reasons. But thirdly, because often in our sector, one of the big challenges we have is around getting and maintaining funding, getting traction, getting policy attention for the projects that we do. And so one of the other key reasons we wanted to do is we wanted to have a way of collating some key ideas about what globally we have found the value of our work to be that would help practitioners and companies to advocate for their work to policy, advocate to their work to funders. So they were some of the core goals. To take that, that's a huge scope, of course, which we were never going to be able to do in the approximately 18 months we had to undertake the project. But we certainly wanted to at least think about what a start to that work would look like and how we could set it up to be an ongoing thing. And that has been sort of at the core of what we've tried to do. We took an integrated approach that we decided the first thing we should do is map what is known publicly published kind of evidence. And so we looked to journals, we looked to published research documents, we looked to those sorts of documents. We did a massive sort of search for those documents, and Eliza will talk to our methodology about how we kind of approached exploring that data. But the other thing we wanted to do was that we knew a huge amount of work and evidence about what our work does is sitting in drawers or on laptop files in theatre companies all around the world. So we did a call out to say to theatre companies and practitioners, send us your evaluation documents that aren't available in the public realm, what we call grey literature, because we want to ensure we include those. And then once we'd done that work, the other thing we wanted to do is we wanted to test whether or not what we found, we wrote about our work, actually resonated with practitioners when we talk to them about our work. So do we write about our work and the value of our work in the same way we understand it and talk about it to each other and to our participants? And that was a sort of a key element of our project too. So we put those things together. Can I get the next slide, please, Eliza? We put those things together to ask these kind of core questions. And the core question is, how does engagement with theatre impact the lives of young people globally? And how do we know? Okay, and so we took a mixed methods approach that included a systematic literature review. And part of that, and Eliza will speak to this, is we wanted to ensure we only counted stuff that actually collected data from young people, because a lot of work out in the world is adults talking about young people, but not actually collecting any sort of data, not even conversations with young people. So we wanted to make sure that we were including data and voices from young people about the impact. And so we did a systematic literature review, and then we used the findings of that to inform some direct kind of feedback sessions with Theatre for Young audience practitioners. Eliza, you want to go to the next slide? Okay, so I'm going to hand it over to Eliza to go through some of the methodological kind of aspects and the initial findings that we got from our literature review.
Thank you, Kelly. Good evening, everyone. It's so lovely to be here to share this work with you all. And I'm coming to you from Gadigal land as well. I am going to talk about our systematic review and evidence gap map, and then I'll hand back to my colleagues to discuss kind of how we integrated that with feedback from stakeholders. So for the review and gap map, the goal was to identify and analyse the existing research on the impact of theatre for young people. And we did this by doing searching databases, academic libraries, journals, and we targeted 3 key concepts throughout that. So theatre in all its forms, young people, and value. And that kind of broad approach allowed us to find as much as we could of these studies and be able to categorize them in a way that demonstrates where the research is. So in order to do that, we had to filter studies so that we were directly answering the research questions. One of those filters was, as Kelly mentioned, is this data actually coming from young people, or is this what someone says happens to a young person? But one of the other ones was making sure that we that we were targeting all three of those domains. So not just theatre and young people, but there was some sort of outcome that was perceived to add value. So initially we gathered a lot of studies and went through a very arduous task of screening and reviewing that until we got down to 190 manuscripts. And that was both the amalgamation of the grey literature and the academic literature. We then went through and coded these papers in, we used a rather blunt instrument, but only insofar as that was what we were able to do with what we had. So we coded everything by region, publication language, the design of the study, the age group of participants. So that was broken down into pre-primary, primary and elementary, high school, and then young adult. The types of interventions were coded as either audience-based experiences, educational drama, health, those kind of things. Oh, sorry, participatory theatre, so like doing or making theatre. And then the outcomes were coded in as to either health, education, social, or other. And I'll explain a bit more about what fell into those categories. And then we also looked at what were the limitations. And we also coded papers that discussed outcomes that things either didn't improve or had no change. With that being said, of the 190 studies we had, some reported in some areas maybe things getting worse or no change, but every single study reported a positive outcome for these young people who engaged in theatre in some form of another. So this explains the search strategy, and apologies for this slide, but is just a simple way of showing that we started with about 7,200 pieces of writing, and we came down to 190. So as I mentioned, all of the studies reported some positive impact. Those impacts were broadly social, which was the majority of 112 studies, educational, health, and then other was the smallest. Some studies reported outcomes in multiple domains. Geographically, the majority of studies came from Europe, 74 of them. The next biggest group was North America, and then there were significant gaps, which I'll discuss a bit more as well. The interventions were predominantly educational in design, followed by theatre making and audience participation. And I'll just take a moment now to show you how before I drill into the results, I'm just going to show you our gap map, because it's a funny word that probably doesn't mean much until you see it. So one of the kind of key outcomes was that we wanted to make sure that practitioners and companies and artists all over the world actually had a way of accessing this evidence in a way that they can use to advocate for their work and to better understand what's out there, and for researchers to understand what's missing and what's already there. So this is our gap map, and I'll just explain briefly how to use it. So on the left, you have the outcomes, and at the top, you have the interventions. So if I am a researcher, or let's say I work for a school and I want to write a report on educational drama and show that it has pro-social outcomes, I can click here and I can see the 29 studies that are included that have that. And each of these colored dots indicates a different age group. So you've got 13 of the studies were in high school, 10 in primary school, 4 in young adult, and 3 in preschool. You can also filter this. So if I'm only interested in preschool age children, if I want to look particularly at limitations, if I only want to look at Turkish papers that happened in Europe that were randomized controlled trials, I can plug that in and get that as well. So that is really how we wanted to map this evidence.
Can I add to that, Eliza, that one of the really
Yep.
great things about this as a sort of a project is that, as Sue said, there is some ongoing funding, and that is a live document. So as we do the next round of funding, we can plug back into that, and it can just grow in terms of the evidence that it can provide. And so when we know there are significant gaps, we can actually take a targeted approach in the next round to ensure that we're filling them and they're evidenced in that gap map.
That's great. Thank you, Kelly. And can I just check that you're looking at the slides now? Great. So I'll just discuss some of the results, break it down a bit more. So in the yellow, this is looking at what the review showed by outcome. So what these papers showed were the outcomes. So the yellow ones are social. And these were broken into personal, pro-social, life skills, and political, or socio-political. So personal outcomes included things like improvements in self-efficacy, confidence, resilience, or motivation. Pro-social outcomes were things like building community, working together, getting along, perspective taking. Life skills were things like understanding and reporting my rights and responsibilities, and pro-social outcomes were things like, political and social outcomes were things like activism-based changes, so writing a letter to Parliament or increasing knowledge and awareness about climate change, and that having a socio-political outcome with it as well. Education outcomes are represented in orange, and so broadly, these were curricular-based outcomes, which included academic outcomes, like improvements in science for young people who engaged in a drama-based pedagogy. Engagement was another one, and that looked at qualitative and outcomes, so people enjoying school more, but also quantitative measures like increased attendance. Reading, writing, and literacy were also included things like a language acquisition for second language learners for people that have had a drama exposure or theatre exposure, and then theatre knowledge, which included kind of skills that you would associate with drama and theatre, like lighting design or script analysis skills. In blue, we have the health-based outcomes, and so they were categorized as health education. So that would be a study that might have used a drama intervention, and then the young people reported a deeper understanding of HIV risks, or learning about healthy bodies or healthy lifestyles. Mental health and well-being categories looked at things like depression and anxiety, and general health included non-psychological health outcomes, physiological responses mostly. So that's how the outcome, the studies came out by outcome. When you look at them by age group, you get a different story. So we wanted to see actually where are the interventions being targeted. Interventions, I use that word very lightly. Where is the work being done in which age groups? But not only that, where is it being reported on? So you can see here that studies are happening mostly in high schools and primary elementary settings, with fewer in young adult and even fewer in preschool. 47 of the manuscripts that we reviewed did use participant samples from multiple age groups, so that's something to consider. But you can see that within the school-based experiences, the outcomes, which are represented on the outer ring, are represented mostly as educational as well. So there's a lot of work happening in schools that relates directly to school-based outcomes. When we break it down geographically, you can see that the majority of studies happened in Europe, which I mentioned, which was 74. North America, there was 69 manuscripts. Asia and Oceania both had 21. And South America 4 and Africa 5. You can see here that Western countries really dominate the literature. In terms of languages, 178 of the 190 studies were published in English, with 10 in Turkish and 1 each in Spanish and Romanian. And we'll discuss more about kind of what that means in terms of how the data is represented or underrepresented a bit later as well. But for now, I will pass back to Kelly and Michael.
Thanks, Eliza. Can you go to the next slide? So once we had this data, some of which was exactly what we were expecting to get and some of which was quite surprising and interesting, we wanted to use it to instigate a conversation, I guess, about whether or not these almost 200 documents that we had coded actually do represent what it is that practitioners working in the space consider the value of their work. And if so, how? And if not, what are the disjunctures, I guess? What are the differences that exist? Or what is the story that is not told? And so in order to do that, we took I think a 1 to 2 page overview of those findings, including the early version of the graphs that Eliza shared just then, to the ASSITEJ artistic gathering in Serbia last year. And as part of that, we ran a 2-hour workshop where, because we are who we are, we decided we would do some activities, some embodied activities, some arts-based activities, using these ideas as sort of a pretext, I guess. And we recorded those. And we did a lot of different things. We did gallery walks where in groups people explored things on butcher's papers, ideas on butcher's papers, and then we walked around and added to each other's ideas. We did found poems where we looked at some of the ideas that we talked about and kind of then performed those poems in groups. We had some significant discussions, and we did a few other embodied and drama-based activities. And that was all recorded. And then we brought that back, and like you would any qualitative data, we treated it a lot like an interview or a focus group, where we looked at what people were saying, what people were writing, and what people were telling us with their bodies, to try and unpack some of the bigger ideas and how people were interacting with our findings, to give us a sort of a deeper or more qualitative perspective to the work. So Michael, did you want to talk a little bit about those findings?
Yeah, sure. Do you want to just give me the next slide? Yeah, great. So, sorry, the slide back, Eliza. So what we did with the outcomes of those workshops was to collate them. And many of you may have been at that workshop, so you'll know what it was like in the space. Lots of discussion, lots of activity, lots of embodiment, and then collating that information in different groups. And what we did is we brought all that information together and we analysed that information to see if we could extract themes. And we wanted to understand whether the themes that we were getting from artists and practitioners were the same kinds of themes that we were getting from the other parts of the research study. And in a sense, it didn't bother us if there was a different perspective. We just wanted to make sure that ASSITEJ members perspectives were included in the data and certainly in the findings of the research. So maybe next slide, Eliza. And the findings break down into these kind of 5 broad areas. Friendship and togetherness came up as a really critical reason of the value of theatre for young audiences. So this is the people in the workshop saying that they thought that the opportunity for friendship and togetherness and actually working together on an artistic pursuit or a creative pursuit was really critical. The second one was joy, which I was really pleased to see, that there was a kind of joyfulness in the work. And we hear this again and again in arts education, that students and young people find joy in the artistic process, find joy in the collaboration, and find joy in the things that they're doing with other young people, and also as being part of performances for young audiences, as audience or other kind of participation. The third one, which of course intersects with joy and certainly friendship and togetherness, is play, curiosity, and creativity. Now, these were kind of grouped because they are very much alike in the research literature, and they seem to come together in the kinds of feedback that we were getting from the participants in the workshops as well. So that was a really big theme, that actually that the participants thought that these were critical to what was going on. The fourth one was learning, that there was a recognition that there was aesthetic learning going on, that there was pro-social learning going on, that learning across the board was taking place. And then this final one, which of course relates to all of the ones we've spoken about so far, is empowerment, providing spaces and places for young people to have their voice and their concerns and their creativity heard, seen, and engaged with. And those were the kind of thematic findings that came out of that analysis from those participants. And so what this kind of leads to is this kind of circular idea that all of these things feed into each other, that there's this personal growth that leads into social skills, which supports emotional regulation, which has cognitive benefits, which has been found in a whole host of research about the influence of the arts, and leads to educational gains. Eliza, did you want to add anything to that?
No, just that when you look at these kind of thematic findings, they are unique, but very clearly map onto the impact findings. And I think that's what's really useful about this part of the research, is the themes that arose have a connection to the impacts that we've identified as well.
Yeah.
Just offset that those impacts often overlap.
And I think it's kind of gratifying on one level to see that level of mapping, but it's not one for one. And the research and the kind of feedback that we got from the participants didn't match exactly, and we wouldn't expect it to. But it's not like our participant research was saying one thing and our impact findings were saying completely another thing. They certainly coalesce and they chime with each other quite strongly. Maybe the next slide, Eliza. So gaps and future directions. We need really to be in the next phase looking a bit more widely in terms of the geographical diversity of the work that we were able to capture. We tried very hard with limited resources and time, but we didn't capture as much as we'd like from the non-English speaking world, and although we did capture some, but we didn't capture as much as we'd like. Now, that may be because it's not there. We certainly went out to all ASSITEJ members and asked them to send as much information as they could. And thank you if you were part of that process and contributed. As phase 2, we'll probably do a similar thing So we're really keen to get a better spread and a more diverse spread. This second idea of intervention types. Intervention, of course, is a contestable word. What we mean by that is the kinds of studies that we saw when we brought them together. So, and there are a preponderance of very small case study type studies, which are great, but not the kind of longitudinal studies that you might find in other fields. So we're really interested to start looking and seeing if we can find more of those kinds of studies.
Some of the questions that we're asking ourselves, just to jump in there, some of the questions that we're asking ourselves is, to what extent is this we didn't capture the work because we're looking in the wrong places? To what extent is it we didn't capture the work because the work isn't there in this format? Like there are some, colleagues that would say to me that work in Brazil, for example, that it's just not part of the same kind of culture to publish the way that we might publish in Europe or in but there's also the other question we're asking ourselves, to what extent does the work exist there and in these spaces, but we're using the wrong terminology. So we're using the wrong we're looking for the wrong kinds of interventions, or we're using the wrong search terms. And so it'll be a bit of an experiment around those spaces in this next phase, now that we've got this initial data.
And I think, to Kelly's point, that the nature of this kind of exploratory study is to find out what we don't know, really. And we've now got a better handle on the kinds of questions that we need to be asking to be finding the gaps, or finding out why we've got the gaps. The third one is health outcomes. We're really interested in maybe some of the work that's talking about health outcomes that we haven't captured, potentially because we haven't been looking in the right journals, but they might be there. And so we're really interested to see if there's more evidence around that kind of, and more work around that kind of thing. And then this fourth one, which wasn't part of the study, but came up in discussions with participants in Novi Sad and in Serbia generally, which is this idea of the tension between public utility and aesthetic integrity. To what extent are young people engaged in this work, and do young people have a right to engage in this work just because they have a right to theatre and they have a right to this aesthetic? And to what extent is public utility or the application of this work in health, in wellbeing, in education, part of that? And so it's really understanding the relationship between these two, or indeed the disconnection between these two. And so that's something that we're really interested in exploring further. Okay, next slide.
Can I dig a bit deeper there just too with that? This is one of the really interesting things that I believe is a deep challenge in our field, is that a lot of the reason why a lot of us would do the work is not kind of utilitarian. It's not about being useful to the state or useful to the institution, or, and yet a lot of us are in situations where we have to couch our work in that way often in order to make it relevant to funding bodies. And so when we're doing this kind of work, that is a delicate space for us to traverse, because it is important that the usefulness of this work for health, for education is there. There's advocacy around that and the need for these sorts of things. And I don't think we would ever want to deny the usefulness of this work to those spaces. But by that same token, it can sometimes hide or disguise, or even just completely overrule any conversation in a public space about the right for art to exist for art's sake, and the importance of art just being there, being good art, and people being able to engage with good art. And even those conversations, interestingly, when we talk about kind of what used to be couched more as high art, also pure art, often now, even when we talk about that, it gets kind of funneled into conversations about, well, it's important people engage with good art because it makes them feel better, it makes them better connected, it makes them happier, it makes them wealthier, it makes them healthier. So the sort of the neoliberal discourses around the use of art and the importance of art being useful to society is something that we don't want to deny, but we also, I think, need to balance for ourselves as a field, because how we write about our field is how our young practitioners and our young researchers learn about our field, right? So if we spend all of these decades only writing about the usefulness and the utilitarianness of our work, that is how people will learn what it is to be in theatre for young audiences. That's what the next generation will learn about who we are. And so I think that it's important to keep asking those questions in this space. Sorry, thank you, Michael.
No worries. So the recommendations for future research that emerged from this report that ASSITEJ will publish pretty soon is that we should expand the geographic scope. Obviously, we've discussed that. We should look for more diverse interventions, and we should look for longitudinal studies. And it's got strategic implications as well for ASSITEJ and the theatre for young audiences sector more broadly in terms of policy development. This can help us understand the kinds of policies that governments and European Union and other places should be putting in place to help develop this sector. It can help us understand the kinds of research that we need to inform that policy as well. It will also, in some ways, help with program design. I can see program designers using that mapping tool that Eliza showed earlier, just to help them understand where the research is coming from. That will help them with their designs and also indicate the kinds of things that have been successful in other contexts. And thirdly, community engagement. If we want to talk to our communities about this work, we now have the tools, or we now have some of the tools we need to make the case for the work we do. Now, we've really just done the first small piece of that work, but in phase 2, what we're hoping to do is expand that significantly and give theatre for young audience workers and artists and students and young people the opportunities to engage with this research so that they might engage with their communities about why this work matters. Okay, there's the references, and back to you, Sue, to take questions. And we're happy to take questions, obviously.
Thank you so much, Michael, Kelly, and Eliza. So yes, questions, people. We have about 10 minutes to see if anyone has any questions for the researchers. Please, this is your time. While people are thinking, just would like to make it clear that the outcomes of this will be shared, will be part of our reporting, and will be there'll be public access to the research findings on our website. Excuse me. Any questions for?
Yes, I would have one.
From the room?
Yeah. As I'm a researcher in the field of actually social works, but my interest is in theatre for and inclusive theatre and the theatre for people with disabilities. Then I will bore you in emails probably soon also. But in here, my question is that did you find on their literature review something interesting, important in the field of the people, children with disabilities and art's impact for them?
Not specifically, no. Not so much that we needed to code for it, if that makes sense, that it did seem to be lacking. However, that could be that we weren't looking specifically for it, or we weren't looking in the right spaces as well, because I'm sure that research exists and it would be really wonderful to include that, but no, not really from memory.
If you are working in the area and you have papers that you know of that we would love for you to send them to us so that we can include But also if you email me, we do have some great colleagues working in applied arts generally in this area that we can send you their contact details to if it's helpful.
Just
Yeah,
on that,
yes,
Kel,
absolutely.
for the team, just on that, how can people best get in touch in terms, we don't want you to suddenly be flooded by a million emails, but is there a process that you'd prefer for people to get in touch with questions or with research papers from?
Email is fine. I actually have a little folder. My email is not usually very organized, but the ASSITEJ project, I do have a little folder and it is quite well organized. So we would very
Great.
much appreciate emails coming through.
Great. If you wouldn't mind sharing your email in the chat, Kelly, that would be fantastic. Thank you. This idea of where the gaps are is a really important one, and also makes it very clear to us where the majority of thinking has been and where the new areas of thought have not been developed yet. So it's really important to know where the gaps are. Vicky.
Hello, everybody. I'm a white woman, older woman, wearing glasses, and my background is a very messy office. I'd just like to ask something rather obvious. At a time when, in my country, England, and maybe the UK, drama and theatre are in absolute jeopardy, they're in the worst state I've ever known them. How can we bounce off this research to make it useful? How do we kind of apply it in our everyday lives to persuade the powers that be that drama and theatre is important in the lives of children? I know you say the usefulness of these art forms is a difficult one to negotiate, but we have to use the usefulness because the pure aestheticism is not being recognized. And there are so many troubles and traumas in everyday life that the arts are really being beaten down. So have you any suggestions of the most powerful way we could take your research and use it to progress the situation? Thank you.
Thank you, Vicky. I'll jump in, but I suspect my colleague Michael has things to say on this one too. But thank you for the comment, and you're absolutely right. And I think a key purpose of this work is to provide the community, our field, with easy access to kind of statements, claims that are actually genuinely backed up by evidence that you can use to argue for funding, to argue in your schools, to argue in your community centres, to argue to your politicians. It was a key part of what this work tried to do. And I agree with you that, and I've been doing some work in the area of looking at the history of drama education at the moment, and the history of drama education in the UK, which is heartbreaking at the moment, which going from what was quite a radical and creative and playful space to essentially, I speak to my colleague who works on the ASSITEJ project too, who talks to theatre companies that say they're doing the work that schools used to do of trying to engage young people in theatre because people don't have access to theatre anymore. Young people increasingly do not have access to theatre in schools or in funded theatre projects anymore. So I think it's really key that we do have this kind of work that's happening that will provide us with a space to advocate that is evidence-based, that is spoken in the sort of language that policymakers want to hear. And I guess my sort of little rant before was just that I think it's important then when we are speaking to ourselves and when we are speaking about the work that we do and the purpose of the work we do also remember that we are not just that story that we tell for funding. We are not just the story we tell to funders in a crisis, right? We are that, but we are so much more as well, I guess. Yeah. I know that doesn't answer, Michael.
Just picking up on what Kelly's saying, I think there's a real danger in being ambulance arts, that we turn up after everybody else has had a go and no one can fix it, and we're supposed to fix it kind of magically. But I also do think the work that we've done will form a basis for some really informed arguments with policymakers, because what the gift of this in some ways is that you now have a report, or you will have very soon a report that you can go to, and you can prosecute arguments from an evidence base. And I use that term advisedly because it's being used in a very narrow sense. But there is evidence in this report that you can then take and put in your funding applications and kind of focus your discussions around that. I'd also say that the interactive piece that Eliza showed you will also be useful for that. So you can really kind of drill down into the specific area that you're doing research in, or you want funding in, or you want to advocate for, and it'll give you what we've found so far. By the way, if you see gaps, please also send that through to us. And if you know of a paper and you think, wow, they haven't included that, there may be a reason. We may have excluded it because of the criteria, but we may also be able to include it. So it's really, in sum, a way to kind of use the evidence effectively and well when you're making those arguments.
Giovanna, and then Louis.
Yes, I wish to know how in the future, or you think, or if you did it just in the last research until now, how the impact of this time of war and feeling that the young people have in this time, last 2 years, I think 3 years, and how it is how it was the impact to the young people, and how between the theater they feel it. I don't know if I explain, and it's clear the impact of the wartime in the last 2 years, and what happened in the social policy, that is very, very, very hard, and how it will be the impact to the young people, also between the theater practice, and the experience, and also how in the body, especially the body, is important, how much is important, or how it react the body, in it, in this time, and or in general, and I don't know if in your research you focus on it. I don't think so, but I think that it's quite enough what you did, it's a lot, really. But thank you very much, because it's really great works that we need it in our practice every day, and we can use it, of course. But my curiosity is around the body, the rule of the body in it,
So
yeah, sorry, my English is not so good, but
no, I completely understand what you're asking. It's fine. And thank you for that question. I think they're two great questions. Eliza may contradict me on this, but my sense is the impact of conflict hasn't yet flowed through to the research extensively, and so we're not seeing it yet. I expect that we will see much more of that work come through in the next 3 or 4 years, and of course we'll be around to engage with it. The discussions around the inherency of the body in this work, it's not something that was explicit as far as I can work out in the research. Like the participants didn't bring that up as much as maybe I might have expected in the participant research. However, I think it's something that a lot of people talk about as part of what they're doing in their research, but they don't necessarily focus just on that. Eliza, do you want to feel free to contradict me on that?
No, I think that's right. I guess the other thing to say is that we haven't focused in on every part of every study. We were looking at really mapping these broader outcomes. So it may be there in particular papers. It's just that we haven't focused on at this stage, pulling it out as well. But to my knowledge of reading these studies, that wasn't a theme that emerged strongly.
So I am thinking back to a really great paper that I love that came out a while ago in Arts and Health, and not specifically theatre, by Annie Wars, which was sort of suggesting that in Arts and Health there was this, actually the focus on looking just at the impact and outcomes was doing a kind of disservice to the field, and that there needed to be as well as much focus on sort of theorizing and analyzing the practice and the sort of how is it that we get to those outcomes, like what is it that's happening, that's being done. And there's been some subsequent research in the arts and health space. I'm just wondering if there's anything that you're planning to do in your review or that's already come through that's not just around the evidence of the outcomes, but the what is it that's distinct about these kinds of theatre for young audiences that gets to these outcomes that other kinds of activities for and with and by young people wouldn't?
Okay, I'm going to jump in. That's an excellent question. I knew you'd ask a hard question.
Sorry,
so
something
look, no, it's a good question. I think it's a question that we'll take away and play with for a little while. But I think my immediate response, Molly, is that part of the mandate was to look at impact, right? And so that's very much, it was a relatively, for the scope that we had and what we were trying to do, which was a large mapping, it had to be relatively blunt. I mean, one of the things that we found really interesting in the health stuff was that in terms of health outcomes, we found very little. A lot of kind of intentions of projects were to have health outcomes that ended up spending all of their time talking about what were effectively education outcomes or social outcomes. And I think that probably has to do, if you drill down to the type of intervention it was and the type of the work that we do, but also the ability for us to gather evidence around those sorts of outcomes. So the short answer is it's not something we've given a huge amount of thought to, but I think it's a really good point in terms of moving forward and how to have a more, when you think about, the sort of what I was talking about before, the difficulties of needing to be about usefulness and about the outcome and the impact, but also wanting to maintain integrity to who and what we are. I think that's probably a really useful space for us to start thinking that when we talk about impact, we don't just talk about the end point, but we actually also talk about what it is that we're doing together in our bodies, in a space to get there. So I think it's great. I'm going to take it more as a comment though, because I don't have a way of answering it unless Michael or Eliza want to have a go.
I was just going to say that I'm not like super across this space, but Michael and I did both work on a paper that we also published through Arts and Health that looked at early childhood interventions, and we noticed a massive gap in an understanding of those mechanisms of change. And so whilst we're not looking at that specifically, I wonder if that is what is also happening in this literature, that actually researchers are not focusing on, well, what is it that happens in that space that's so magical that leads to that? Or so I don't want to say that for certain because I don't know, but I wonder if that's part of it, that actually those middle bits are this kind of curious thing that is still undiscovered. Yeah.
Yeah, the only thing I want to add to that is it is the big question, I think, in arts education as well, how we understand these mechanisms. And I think we got hints of it in the participant research. That's why I think the participant research stuff around friendship and joy, et cetera, gives us some really strong clues, but we don't have the actual evidence to yet to really clearly make that claim, or make the claim that it's because people are relating more, or kids are relating more to each other, that they've got better mental health outcomes or whatever. I mean, I'd love to be able to do that kind of research because I think it's critical, not only in arts education, but in theatre for young audiences and kind of across the spectrum. So, yeah, I think much more needs to be done there. Thanks, Molly. Great question.
We're going to bring us home with Louis' last question.
Yeah, I'm coming back to the question from Vicky about how we make this have a direct impact on decision making in a way, and I think that's a task we can only solve collectively as a sector. But I think at ASSITEJ International and in the research team, we have some work to do in terms of illustrating and unpacking the research in different ways. And I also think we will connect it to the World Theatre Day of ASSITEJ. We will be employing a new person that can drive that campaign so that they can bring in some of these findings and unpack them in relation to the World Theatre Day. And then it's also about influencing policy development. And of course, also about bringing this research spaces and hopefully the right anecdotes and illustrations into the political relationships, because we know that often it's about involving directly with decision makers and creating the relations. And that's something that we can only really do with national centers, with individual artists, with networks on different levels. So that's really a long journey. But I know that we have to start right now. That's what you say always, Vicky. So I think it's a good basis, and let's explore the ways we can make it really have a direct impact as soon as possible.
I'll bring this session to a close, everybody. So all of this research is about building advocacy support and benefits for ASSITEJ members, for TYA practitioners, and for the wider TYA community. And the final research reports will be published on an open access basis through our website and in French and Spanish as well as English. And it is meant to be used. So we're going to try and create the kinds of toolkits and ways to disseminate all of this information that's going to be really useful for everybody. And one of the big things about this, and one thing I love about the title of this whole research, is the value of it. And the value actually comes down to the value we hold for children and young people themselves. And in so many societies, we don't value those children and young people as cultural citizens. And so that is at the core of all of our struggle for recognition of this form and the rights of children and young people to arts and culture. So this is a project that we're so excited about continuing, and I would like you all please to thank Kelly and Michael and Eliza for presenting for us today. Thank you so much.